all across America and around the world. This is Veterans Radio. This is Veterans Radio.
Welcome to Veterans Radio. I am Jim Fausone. I'm the officer of the deck today. We've got some great programs for you. I think you'll find very interesting. We always want to remind you can find more about Veterans Radio at its Facebook site or by going to veteransradio.net, where we're on the web 24/7. You can find a lot of our podcasts there as well. We post new ones every Tuesday, so you can get a new story, a new interview, something you didn't know before by going to veteransradio.net. And before we get started, we want to thank our sponsors. First up, we want to thank National Veteran Business Development Council, nvbdc.org. It was established to certify both service-disabled and veteran-owned businesses. You'll find out how they can help your business by going to nvbdc.org. We want to thank Legal Help for Veterans. Legal Help for Veterans fights for veterans' disability rights all across the nation. You can reach them at 800-693-4800 or on the web at legalhelpforveterans.com. Well, we have a special program here on Veterans Radio today. I want to bring on Army veteran Mark Aldrich and VA doctor, Dr. Kishor Patel. We're going to talk about some therapies and approaches used by the VA today that might be something you haven't bumped into before, but maybe you should, and that involves acupuncture and whole health. So, gentlemen, welcome to Veterans Radio.
Thank you. Happy to be here. Jim.
Well, Mark, let's start with you. You've been on Veterans Radio before. We're talking to Mark Aldrich. He retired from the U.S. Army in April of 2021. He's now a 100% rated disabled veteran by the VA after 3 combat tours over a 14-year period. And we've had him on before to talk about his business. He's an entrepreneur. He has 2 entities, one called J-Dog Junk Removal and Hauling and Demolition in Plymouth, Michigan, and also just started J-Dog Carpet Cleaning and Flooring Care in Ann Arbor, Michigan. So we talked about the business aspect before, and part of that, he kind of lured me into this topic. He said, "Hey, have you ever talked about anybody who's got acupuncture before?" So why don't we start there, Mark? Explain to us what medical conditions kind of brought you to, hey, I'm willing to give that a try.
Well, Jim, it all started out a few years ago. I had filed a claim for some neuropathy and plantar fasciitis, and the claim had actually got denied. And so I resubmitted, and part of the final approval process was going to a final all-end C&P exam, and that was with Dr. Patel. And so once I got to the C&P, I was kind of nervous. I didn't know which direction this was going to go. And Dr. Patel and I started just having a conversation. He looked at the documentation and he goes, "I don't quite understand how this got denied. All the documentation, the paperwork is there. There's clearly an issue." And as we were talking, I was telling him about some of the other issues and some of the other ratings that I had for other disabilities. And he was kind of looking through it. And when we were talking about my back, my neck, other issues with my knee, and just overarching disabilities that I had, he kind of mentioned, "Well, I'm currently doing this program, this Battle Field Acupuncture, that you'd be a good candidate for. Why don't you reach out for a consult and let's see if we can relieve some of that pain?" So about a month or 2 went by. I had reached out, done a consult, and had my first therapy session. And within seconds of first needle going into my ear, I had relief. And it took my pain that was normally around 8, 9, sometimes even a 10, down to a 3, 4 in that first process. When I got up from first treatment, my gait had not completely cleared up, but my gait on how I could walk was substantial in just being more pronounced and not having to kind of walk with a limp and shrugged over all the time. So that's how I kind of got involved. And so we did this for probably with the Battle Field Acupuncture of the ears for about maybe 6-8 months. And as we were talking through at our sessions, he said, I'm also doing full body acupuncture. Why don't we try and focus on some other areas and try this out? I really do not like needles, so I'm very skeptical also about holistic approaches. I don't like needles, and so I said, all right, let's give it a try. I'll suck it up and let's try it. And we've been doing this ever since with the whole body, and it's just helped me dramatically. My pain management has gone down from a 2 or 3, from an 8 or 9 down to a 2 or 3, and I can go weeks, if not a month or more, without having another session and having a low pain ratio. And I'm a big person that kind of has an addictive personality, so I didn't want to go on pills and be subject to every day taking a pill and still having that same amount of pain. This was an opportunity that I can now have less pain and I don't have to take pills.
Well, let me bring in Dr. Kishor Patel here. He got his medical degree from Ohio State University College of Medicine. He has been practiced for more than 20 years now. He's an internist in Ann Arbor at the Veterans Affairs Ann Arbor Healthcare System. And first off, Doctor, it's hard to get testimonials like that from big, strong veterans who cry when you put a needle by them. But you can't tell us how you got involved in looking at acupuncture as a possible method for pain relief and symptom relief.
Yeah. It's been a kind of a fascinating course. My background has always been strong in the sciences. My undergraduate was biochemistry and chemical engineering and very much steeped in the sciences. But what was unique about the way that I was raised, which I had of this Indian heritage, even though, I grew up partly in England and partly here, they were very much steeped in Ayurvedic medicine. So looking at kind of the holistic kind of approach. And so that's always appealed to me. And even in my traditional practice, I've always recommended plant-based foods that decrease inflammation, and discuss that. In 2016, we received a grant to, the VA received a grant, the VA, to try to implement other ways to kind of manage pain. And one of the approaches was instituted by a person that was named Nogier is the original guy in France who developed this kind of map, but we also had Dr. Nimnitz, who was part of the Air Force acupuncture division, and he had developed a quick approach to helping as many veterans as he could, and we labeled that as something called Battle Field Acupuncture, or BFA, right? BFA. So, and the term, even though it does involve needles, and there is the 5 general points, but the goal was to try to decrease as much pain as we could in our veteran population. And as Mark pointed out, he wanted to avoid medication, which is true for many of the veterans that we see. They want to decrease medications. They definitely don't want to get dependent on them. And of course, that was a little bit at the height of that opioid awareness, right? And we wanted to decrease the number of opiates also. So anyway, that was in 2016, and I trained with his group, and we learned about the Battle Field Acupuncture, and then we kind of implemented it at the VA. So really, since 2016, we've been having these clinics, but not a lot of advertising, not a lot of veterans, a lot of just word of mouth, and we had brochures, and I think people would sometimes look at it and go, oh, this involves the ear. But it really is the ear in terms of acupuncture. You know, we have in acupuncture, we have something called microsystems, and so, you know, people are familiar with scalp acupuncture, hand acupuncture, foot acupuncture. Well, the auricular, or the ear, is also very rich in terms of signals from the brain and controlling areas of pain. And you can see the whole body represented. I think I've shown Mark this map of the ear and all the points on there that could help with pain. So in Ann Arbor, we actually took it to another level. So we started off with the BFA, and we still have the regular BFA clinics, but we also instituted, which Mark was part of, something called the auricular acupuncture clinic, okay, which actually was more targeting different body parts, different body points of pain, with that representation of the body on the ear, and targeting very specifically areas that were causing discomfort for the veteran. So we instituted that a little bit after starting the BFA, and with the training as a medical acupuncturist. So a medical acupuncturist or an acupuncturist is allowed to do more than just the BFA. We were able to institute these auricular acupuncture clinics, and then added to that, which Mark was also part of. So Mark was kind of what was interesting about Mark was,
somebody's got to be the guinea pig, Dr. Patel, and obviously Mark Aldrich was just the right guy for that.
Well, he's not unique in that. Probably about 80% of the veterans we see do get some benefit in terms of the pain relief. But what I was going to say is that he kind of went through that transition. So he went through the BFA, then he was in the auricular, where we were targeting, and he will tell you this, we were targeting areas for his neck and shoulder, and then the knee, and the lower extremity, and we were doing that on the ear, and he was getting tremendous, benefits to that, and then we added the whole body. So BFA, which is just 5 standard points to mitigate pain. Then you can go to the next level, which is an auricular acupuncture clinic, which involves all the body parts, and so you can target very quickly. A veteran population that may have pain in multiple areas. Sometimes they can't always get up on the table and be in certain positions, for the whole body acupuncture, but they can still get tremendous relief of their pain. And then expanding that to also incorporating whole body acupuncture at Ann Arbor. And we've been doing those clinics now for at least a year. We've got 2 medical acupuncturists. We've also hired 3 other acupuncturists that are coming on board, 1 in Canton, 2 here in Ann Arbor. Actually, 4. 1 we're going to hire for Toledo. So tremendous opportunities to help veterans with their pain. And really the BFA, or the standard initial, we've trained many of the nurses also to do that. In fact, I just trained a whole bunch of physical therapists to do that. I trained physical therapists in Toledo that can institute these 5 points, which have really good landmarks. They don't have to be acupuncturists, and they can just do those focus and help veterans with pain. So we hope to make that as easy as just getting an immunization.
Let me jump in here, because I have
Sure.
So whenever I hear that VA has started something with a grant, I worry that when the grant money runs out, well, that worked, but we're not advancing it. We're not keeping it any longer. So
yeah, let me clarify the grant a little bit. The grant was just for education. The VAs have now implemented these clinics, and they're fully funded. Because they're part of the pain management.
So you see these staying around then, Dr. Patel?
Oh yeah,
okay.
Yeah. This is not an initiative fatigue. This is here to stay, and will be here for the foreseeable future.
When you hear something like 80% of the patients get some pain relief out of it, I mean that's pretty good numbers. But then you got to ask yourself, is that the outcome that you're seeing out of the VA Ann Arbor healthcare system, or is that sort of the VA national, because VA is very good at pulling statistics together and doing research.
Yeah.
Is that a broader national
I would say it's a broad national. We've done a number of studies looking at this, and as you mentioned, because we have one system throughout the whole United States in terms of the VA, we can pull a lot of data, and there's been a number of published articles relating to the benefit of BFA and auricular acupuncture.
Now, sometimes VA only does this at large medical centers. That they have specialists there, but I hear you mention community facilities like Canton, Michigan, or Toledo, Ohio. Is this a program that every VA center has, or only some of them? Kind of give us some sense of how broad and wide this is.
Yeah, so BFA, which is kind of this baseline, 5 points, that is available, should be available at just about every VA facility. I know that I personally, since 2016, have trained a lot of individuals in Toledo, Canton, Jackson, Flint, certainly all the CBOCs that are part of the our VA Ann Arbor system. So it is available at all those facilities, and available for the veterans.
But if I'm down in Texas or Florida or California, is it likely that my VA center also is participating at least in the BFA, if not the larger auricular clinics?
It should be. I mean, my understanding is the training was instituted, and we tried to train as many individuals. We've got certified instructors that can train others. And like I said, it's not limited to MD providers. I mean, we've got nurses, LPN, we've got physical therapists that are doing this. So really, the 5 points, it should be available to veterans in really any area throughout the United States.
Now, Mark, let me bring Mark Aldrich back in, Army veteran who's been a patient of Dr. Patel's, and more importantly has been through a lot of these acupuncture clinics. Mark, as you've gone through this, have you experienced any, I guess I'll say, downsides? I mean, is it painful when you're doing it? Is it painful afterwards where the pressure points were hit? I mean, explain to other veterans out there if they have trepidation about this, why they should or shouldn't.
That's a great question, Jim, because there is a little bit of pain involved. And when I say a little bit of pain, it's like getting a paper cut sometimes. When I had the BFA done in the ears, the only difficulty is sometimes sleeping when you roll over onto the right side, and they only do one ear. They don't do both. And they're going to alternate ears every time you come in. So you're not getting the same points in the same ear constantly, where it might create any kind of scars, marks, things like that. But there's always a chance that you might have a little scar or poke there still. But the only discomfort that I really had was when I'd roll over at night, and the little needles that they put in the ears, they stay in your ear for anywhere from 3 days to up to a week, and they automatically fall out. So you might roll over in the night and the next morning and find one that's laying on your pillow or on your bed sheet, but that's truly the only discomfort. When I came to the whole body, every now and then there's a point that when Dr. Patel was putting it in, I'll kind of cringe a little bit, and he'll immediately take that out. He'll massage that area, and it's like it never happened. But truly, it's just like going to the doctor and just getting, it's not as painful as getting an immunization. It's like when I get a paper cut, it hurts for a quick second and then it's gone. And you can immediately feel the energy. And I know this sounds really weird, but you can feel it with the whole body of this energy going between the different points where the needles are at. Almost like if you've ever had a sciatic nerve or something of that nature, where you can feel it actually doing something and working, and you get that almost instantaneous relief, which kind of, it just brings over you this feeling of joy, happiness, that you don't have that pain at that moment, and you don't want that feeling to stop. So anybody that's leery about it, I would say go and give it a try.
Yeah.
It's a lot better than having to live with the amount of pain that you're going through every day. Any type of pain relief where you don't have to take a pill for it, it's well worth it. The fact that I can sleep better at night, that I'm not always stressed out because of the pain, or it makes it where I lose my appetite just because of the amount of pain. I can get up in the morning feeling better and jump out of bed, where before this process, it was a challenge to get out of bed in the morning. So
yeah, and
I would say just give it a try.
Yeah, you gave some good examples of, there's a little bit here, but it's not enough to hold you back. Don't be afraid of it. It's less than an immunization. Sounds certainly less than going to the dentist, and nobody likes doing that either. So, Dr. Patel, though, I want to make it clear to people, this is used for pain relief. You're helping the body overcome pain signals through nerves and what have you. Maybe you can explain it better than I understand it. But it doesn't correct the neck problem or the structural problem in the knee or the back, right? This is pain relief used in that regard.
Yeah, I think there's, when we talk about acupuncture and the use of the needles, we talk about two different components, which and I'll address the other question that you have. It's only for pain in a minute, but we talk about pain relief with the needle, and then we talk about a healing component, with the needle too. But you're absolutely right. I mean, in the sense that we're not correcting the anatomy there, the injury that was occurred. We can't necessarily rebuild that or change that in any way with the acupuncture needles. But there is some healing component, and if there was an abnormal pathway that was sending a signal, we can sometimes, with the acupuncture, it seems to heal that area, and people notice less discomfort. So one of the things that I do notice over time with the BFA, the auricular acupuncture, and the whole body acupuncture, is this decrease in the intensity of pain, where someone may start off with an 8 and then over time decrease to a 6, a 5, a 4, and notice something that's more manageable to them, which gets back to the kind of this whole health model, right, which is the other component that the VA is instituting, which is, what matters to the veteran. If you listen to what Mark is saying, Mark is really saying, hey, I can do these things now. And he's told me about some of the trips he's taken and some of the things he does. He's very active. And that's what matters to him. And what matters, to the veteran, and helping them to reach some of those goals and their mission, aspiration, purpose for their lives. Sometimes that just involves, hey, being independent and taking less pills. Sometimes that's just to go fishing. They haven't gone fishing in 3 years. So focusing on that whole health concept also, what matters to the veteran, not what's the matter with you, but what matters to them, and helping them to do that. And I think these complementary integrative health modalities help with that and allow people to reach some of these goals. So I think if we were to do an imaging, most likely there would not be a striking, but sometimes there is some healing. People are walking better. I saw a gentleman in the clinic just the other day, and he's no longer using his walker, right? So now he's walking straighter. He's using different muscle groups. He's rehabilitating his back by being less sedentary and more movement in a normal manner. And that has its own healing properties, and probably will decrease degenerative arthritis less for him in the future, as he continues his range of motion and mobility. So.
Oh, absolutely. Yeah. Once you cut the pain relief, you can start, as you say, either walking better, straighter, not putting pressure on the other hip or the other knee, or all those things that become secondary because you're just kind of limping along trying to find a spot where the pain doesn't hurt so much. So by lowering. I do want to touch a little bit, Jim, on some of the other roles of acupuncture too, right? So acupuncture is not just for pain, but it can also help with mental health and decreasing. There's a lot of different protocols for anxiety, stress, and even substance abuse. And one of those well known is what we call the NADA protocol. So there are other things that I see patients for that doesn't necessarily relate to just pain relief. Excellent point to make sure that people understand as we come to a close. And Mark, I'm so happy to hear this is working well for you and for bringing this issue to our Veteran Radio listeners and introducing us to Dr. Kishor Patel, who's with an internist in Ann Arbor, Michigan, with the Veterans Affairs healthcare system there. Mark, again, as always, thanks for being part of Veterans Radio.
Jim, thank you for having me, and thank you, Dr. Patel, for coming on. This is definitely something that I hope every veteran can try, and I would really like our military to incorporate this into their own practices, especially for those vets that are deployed. It's another avenue of not prescribing a pill while we're out there on deployments, but getting some relief.
And Dr. Patel, you're doing great work. I'm glad you raised your hand in 2016 and said, hey, this is something I'm kind of interested in and training people and spreading the word. And we really do appreciate you coming on Veterans Radio to help spread the word.
Thank you, Jim. I appreciate it. And really, I think that we should increase the awareness of it. And I've been fortunate to be in a system such as the VA that has been open to integrative medicine, and in fact allowed additional training for me to become a medical acupuncturist and the time that it took to do that. So as an internist and as a medical acupuncturist, it's all been part of the VA Ann Arbor. It's been a wonderful journey to see that we're incorporating not just traditional, but thinking about whole health in general and a holistic approach.
And I want to thank everybody for listening to Veterans Radio today. I am Jim Fausone. It's been a pleasure to be your host. I'm a veterans disability lawyer at Legal Help for Veterans, and you can reach us at 800-693-4800 or legalhelpforveterans.com on the web. You can follow Veterans Radio on Facebook and listen to its podcasts and internet radio shows by going to veteransradio.net. And until next time, you are dismissed.
If you have a VA claim denied by the Board of Veterans' Appeals, contact Legal Help for Veterans at 1-800-693-4800. They're experts in handling cases before the U.S. Court of Appeals for Veterans Claims. Their number again, 1-800-693-4800.
We again want to thank our national sponsors, the National Veterans Business Development Council, nvbdc.org, VA Ann Arbor Healthcare System, the Vietnam Veterans of America Charles S. Kettles Chapter, Ann Arbor, Michigan, VFW Graf O'Hara Post 423 in Ann Arbor, and the American Legion Press Corn Post 46, also in Ann Arbor. We appreciate all your support. You can go to veteransradio.net, click on the sponsor level, and continue to support keeping Veterans Radio on the air. And until next time, you are dismissed.
With Lucky Land Slots, you can get lucky just about anywhere.
Dearly beloved, we are gathered here today to... Has anyone seen the bride and groom?
Sorry, we're here. We were getting lucky in the limo and we lost track of time.
No, Lucky Land Casino, with cash prizes that add up quicker than a guest registry.
In that case, I pronounce you lucky.
Play for free at LuckyLandSlots.com. Daily bonuses are waiting. No purchase necessary. Void where prohibited by law. 18+. Terms and conditions apply. See website for details.